This is truly the poetry of presentation formats. Good ideas distilled to their essence. So sit back, focus your minds, and enjoy the ride. Our second speaker is Dr. Jenny Basran. She is a mom, a geriatrician, a techie, and she is passionate about improving the lives of older adults. She is an associate professor and head of the Division of Geriatric Medicine at the University of Saskatchewan. Jenny, take it away.
Good evening. So when they asked me to talk about what was possible in healthcare in Saskatchewan, I was very excited. When they told me I had 6 minutes and 40 seconds, I was a little less excited. So what do I think is possible? I think that we can have emergency rooms that look like this. And I'm not just talking about the sunny outside weather. I do think that that's possible. It's sunny outside now, but the empty wait rooms. Why do I think I know this? Part of my role that I play is a physician co-lead on the team that is leading this initiative, and I've had to have front row seat at the work that we're doing and the different processes that we're using, innovation that we're using, and just taking a completely different approach. So I thought to myself, how am I going to explain this to the crowd? So my son just turned 13 a couple weeks ago, and he got a Rubik's Cube. So he's working on the Rubik's Cube, he's all excited. Now, how many of you guys had Rubik's Cubes growing up? And how many of you could do the whole Rubik's Cube? Yeah. So then he came to me and said, Mom, I can't do the Rubik's Cube, and said, what should I do? And I'm like, well, I could take it apart and put it back together. It's probably not a good example. I could just fumble around and see if I could get it, but I haven't in 30 years. Or I could kind of figure out what's the best way to do it. Surely somebody's figured this out. So I went to the source of all good parenting information. I went to Google. And on Google, when you start searching up how to do a Rubik's Cube, there's actually many, many websites. And when you start looking at the websites, what I noticed was there a common theme? There's some general principles of how to do a Rubik's Cube. So you always start with a T. At one side, you fill in the top, then you do the bottom row, then you do the middle row, then you fill in the top little corners. So all the instructions are very similar. So I'm watching my son figure this out. I'm thinking, you know, the Rubik's Cube is kind of like the healthcare system. We work if you think about each Rubik's Cube side being one part of the healthcare system, so one side being emerge, one side being acute care. This is not what I'm talking about when I'm talking about the Rubik's Cube. I don't want to build emergency departments that look like this, so that's not what I'm talking about. But if you think about the cube itself and you think about each side, and what's interesting about that and why I thought was a good analogy was we make changes to one side and we don't think about how it affects the other side. So at best, we may be able to do one side, maybe coordinate with the other side and get two sides, which was the best I ever could do with the Rubik's Cube. But when we look about healthcare system, we know that we actually have to coordinate all sides. We need to be able to do that. So I thought, are we applying these principles? Are we applying the principles of how to do a Rubik's Cube to what we're doing in healthcare? And is that a good way to explain what we're doing with this initiative? So unfortunately, the cube doesn't look like this, or healthcare kind of looks like this. It doesn't look perfect. We have patients all over the place. They move throughout the system. So can we apply these principles? So one of the very first things it tells you to do is to make a cross. You'll see a slide of that in a minute. I must be talking fast there. So the first thing is the cross. And I thought, well, what does the cross represent? That's the key critical first step. So to me, the cross represented the focus on patients. So not only is the initiative based on the patient first review and responding to what patients told us was most important to them, but this is an initiative that actually has patients at every level of decision making, whether it be at the RPIW level, all the way up to the advisory and steering committee level. So we've taken that first part. So we've got the cross, so that's good. So then I'm thinking, okay, well, what about the next step? What's the next step that we need to do? And you can see the cross has representation at all the different levels. So the next step says that you actually have to complete the top of the cube, the full white. So you've done the cross, now you can fill in the rest. And to me, that represented that we had people from all the different sectors. So we have people from acute care, chronic care, primary care. The patient, of course, is in the middle, long-term care. So that also is happening in this initiative at multiple levels. It's happening at the Sask Health level, and it's happening right down to the administrative levels. And the other thing that we've done is that this is the one provincial focus. So this is our provincial Hoshin, so all eyes on this, and we're trying to turn this one big dial. So had to throw in a picture also from Southwest Saskatchewan. So this is actually one of my friend's farms. So the middle layer then is the next stage. You have to fill in the middle level of the Rubik's Cube. And I thought, well, what does that represent to me? And to me, that represented the data. So what is the problem? What information do we have about the patient as they go around and around in this continuum of care that we have? So what are we doing in this initiative? We're taking a lot of time to actually figure out who are these patients, what are their needs, and what do we need to do about it. In addition, we're taking the time to really look at probable better practices. I was corrected to not say best practices, but probable better practices. So really going into the evidence and trying to see what has been done out there and what works. So once you've done that level, you have to do another cross on the other side. So this is the other anchoring side. So I thought, okay, well, what are we doing in this initiative that could be considering anchoring? And so I think that certainly having a task team that's focused on it, but that task team also has to do evaluation and make sure that whatever we're doing isn't affecting all the other areas. So we're still having innovation at each level, but how do we make sure that it isn't affecting the other areas negatively? So one of the things that we're innovation is computer modeling. So we've created a computer model of the healthcare system, and we're putting in our own data and really trying to see if we make change here, what happens down the road. Now the next stage then is to fill in the edges, so the corners. So finally we've collected all this information, we've got everybody at the table, and the next thing we're doing is saying, here's your data, here's what looks like is happening in your jurisdiction, on your unit, on your region, on your ward, and here's a menu of possible better practices that may help you. Now look at these practices and see if there's anything that fits your context, that is easily implemented, that might suit your needs. And that's some of the examples that we're doing in this project. So ED triage, home first. So we've looked at these and thought, does it fit what we need? And we're trying to fill that in. So my son, after about 3 days, was able to do the Rubik's Cube. Me, after about 2 weeks, was able to do the Rubik's Cube. So we have till 2017 to get success in the empty waiting room, and I do believe that we can get there as well. Thank you.